Yeah, it's not as hard as we think it is. It's also really important for the couples to be talking to each other if there's a partner around, because it can impact the whole family.
Yeah, absolutely.
Yeah.
Good.
Yeah.
Thank you. All right. Now, can you touch on the many stages of menopause and what women should expect?
Well, let's break it down.
Okay, good.
Okay, so there's 3 different phases, if you will. So some people call it perimenopause or premenopause, and that usually begins in the early 40s. And what does that mean? Well, that means that their menstrual cycle might be changing, so they might skip some. I was talking to a lady actually earlier today. She had a period in January, and she hasn't had one yet. And her complaint was night sweats and night sweats and night sweats. So it gives you the impression that she's going into menopause. Probably not. She's only 42. So we reviewed her adrenal panel, which I'll talk about in a second, which we did first. And she's a little compromised with her cortisol level. So what is cortisol? Our adrenal glands make cortisol, and it's a master gland. The ovaries, there's another master gland. The pituitary, the hypothalamus, the thyroid, the ovaries. All of these, in my opinion, need to function like a symphony. And sometimes you don't know which one is out of whack. So it's very informative to go sort of on a step-by-step in evaluating what's causing what. And when it's out of tune, I can assist the women getting back in tune. And oftentimes it's something easy. Today the lady left with sublingual drops of licorice to help her morning cortisol level be better, which will enhance her overall energy.
Good.
So that's a version of a premenopausal woman. So the medical definition of menopause is 1 year without menstruating.
Okay.
And in the United States, that age is age 51.
Okay.
But to be honest, menopause, I've seen women who are 55 who are still menstruating normally, and they're going, when is this going to end? And we don't know, because everybody's different. What happens in menopause? Oftentimes, those hot flashes are terrible. Women have a really bad time sleeping. This is a time when their libido may be fading. If they're sexually active, their vaginas might be drier, intercourse would become painful. And if I could give a plug, there's a wonderful store in San Rafael, and they have wonderful samples of all different types of lubricants, and you can go in and test them.
Wow.
It's really nice, especially to take your partner in there. Also beginning possibly incontinence, and because the bladder and the vagina are so close together, sometimes a little estrogen intravaginally actually supports good bladder health. So that's something that's really pretty easy to take care of. Also with incontinence, of course, we want to encourage Kegels. I like to instruct a little differently than women who were taught during pregnancy or after birth, where they were taught to do 100 of these really fast, tight Kegels. I learned from a biofeedback technician, if you actually do 5 slow, using your breath, Kegels, it's much more effective. And what I learned is that many women tend to contract their stomachs and their buttocks and their thighs. And you really need to pinpoint the particular muscles. If you think about having intercourse and tightening during intercourse, that's the muscle that women need to use.
Oh, okay.
You don't need to do 100 of them.
So you kind of do like the elevator thing, where it tightens slowly, like
tighten
the
slowly,
elevator,
yes.
let it release slowly.
Exactly. You have it. You could teach this
Good.
class. Actually, I have them use it with a breath.
Mm-hmm.
So counting in 1, 2, 3, hold it, let it out 1, 2, 3.
Yeah.
There are some great physical therapists that I often refer to if that isn't working and there's really too much relaxation. There's some wonderful physical therapists that specialize in this work. And the good news for people who have insurance is insurance covers it.
Oh, good.
Mm-hmm. And that's important for
Yeah.
people to know. They're paying a lot of money for insurance these days, so
Yes.
I just need to put the right diagnosis code on it. And what happens after birth, postpartum, is that the top floor of the vagina relaxes, and that's what precipitates some of the incontinence issues.
Oh, okay.
So, so that's one thing. Then we get to postmenopausal women,
Yes.
and that's a whole nother area. So postmenopause is maybe a year or so after they've stopped menstruating. So that comes with the incontinence that we just talked about, even less of libido for most women, unless they're on hormones. They're still having hot flashes, some of them. They're often having trouble sleeping. And the thing about postmenopausal women that worries me is osteoporosis risk. Women fall twice as frequently as men do, and our bones are not as dense as men's bones are. So in this county in particular, we're always talking about exercising, getting out and walking.
Right.
It's important, like you can ride a bicycle to get your heart rate going, which is wonderful for our cardiovascular health. But if you want to increase your bone strength, you need to be doing impact exercise. Although there is some research about yoga and Tai Chi also being helpful for those things. Calcium, vitamin D, the other minerals that contribute to bone health should be taken as well. And here's where I'd like to mention hormonal therapies, bioidentical hormone therapy. And I want to explain what that term means. So bioidentical hormones actually start as yams or soybeans. And in a particular type of pharmaceutical lab, they are converted into the hormones that we make. So I'd like to show a book here called The Idiot's Guide to Bioidentical Hormones. It's by a local gynecologist, Ricky Polycove. It's $10. And this is such a great book because there's so much confusion out in the media in the world about what does this mean. This book, in a very short time, clarifies and demystifies what this is all about.
Great.
In the medical model, I think that historically too much hormones might have been given. Most of these hormones are FDA approved. That seems to be a concern for a lot of people. Less is more. Let's start with the least amount possible to get rid of the symptoms.
Yeah. Okay.
That's my approach. Yes.
Good. That's excellent. All right.